This lecture is about bone and its role in metabolism. Serum calcium level and bone mineral homeostasis are very closely related to and very closely related, controlled by the synchronized action of vitamin D, parathyroid hormone, and calcitonin. So we will be talking about the calcium, phosphate, vitamin D, calcitonin, and parathyroid hormone, which are playing with the bone. So at the end of this lecture, we will try to understand the bone and its role in calcium homeostasis, the role of vitamin D, calcitonin, and parathyroid hormone on the bone and on calcium and phosphate metabolism. So let's start with the calcium. So calcium, as we know, most of the calcium in our body is in the bone. So 99% of calcium in the bone. Only 1% of the body calcium is in the extracellular fluid, which is in plasma. Not a lot of calcium in our cells. So why do we need calcium for? We need it for the nerve actions, muscle contraction, hormonal action, and clotting functions. And in the plasma, the calcium is about 50% bound to protein, which is mainly to albumin, and 50% is free. And normal plasma calcium level is 2.2 to 2.6 millimole per liter. Calcium is absorbed in the duodenum. There it is an active process which requires ATP, and it is also absorbed in the jejunum. Here, it is a passive process. And calcium is filtered by the glomerular membrane, but it will be reabsorbed. So 98% of the calcium, which is filtered in the kidney, will be reabsorbed. Let's talk about phosphate. Like calcium, most of the phosphate in the body is in the bone. 85% of the total body phosphate is in the bone, and it functions as metabolite and also as a buffer in the enzyme system. And like the calcium, it circulates in the plasma as N-bound form. So how do we regulate calcium and phosphate? And what is the role of bone in their metabolism? So we need to know these three hormones, which are vitamin D, parathyroid hormone, and calcitonin. So we receive vitamin D from our diet or from our skin. And parathyroid gland, which are the small little glands in the back posterior surface of the thyroid, they will secrete parathyroid hormone from the chief cells of the parathyroid gland. And parafollicular cells, C cells of the thyroid gland, will secrete calcitonin. So the name are slightly like, it's a little bit of, confusing, but we need to remember calcitonin, parafollicular cells or C cell, which is from the thyroid gland, and parathyroid hormone from chief cell of parathyroid gland. So let's look at the vitamin D. As we know, the body receives vitamin D from two sources, number one from the skin and number two from the diet. So from the diet, we get vitamin D2 and D3, and from the sun and skin, the ultraviolet light exposed to the skin, it will convert 7-dehydrocholesterol into D3 form, which is cholecalciferol. So this D3 will be taken to the liver, and where there will be first hydroxylation. So after hydroxylation, we will get 25-hydroxy vitamin D. This form of vitamin D is the most accurate indicator of the body vitamin D strong. And finally, they will be taken to the kidney where they will go under second hydroxylation, where they will get 1,25 dihydroxy vitamin D. This is the active form of vitamin D, and which is also called calcitriol. So the job of the calcitriol or active vitamin D is to increase the gastrointestinal tract absorption of calcium and increase the osteoclastic resorption from the bone. So osteoclast, I believe you remember from the bone lecture, osteoclast is the hematopoietic cell origin, and it increased the bone resorption. Opposite to osteoblast, which deposit bone. Okay, so the activation of this vitamin D in response to decreased calcium, so that is a feedback mechanism. So when there is reduced calcium in the plasma, this vitamin D secretion activation will be increased. When there is reduced phosphate, then vitamin D will get activated. And when there is parathyroid hormone, we get the active vitamin D. Let's talk about parathyroid hormone. They are from chief cells of the parathyroid gland. And this parathyroid hormone secretion is regulated by calcium and phosphate level. So when there is increased vitamin D, action of parathyroid hormone increase the vitamin D level, increase the kidney reabsorption, and increase kidney phosphate excretion. So these are the jobs of the parathyroid gland. So it will go and increase the vitamin D3 level, which is the active form. So there will be increased calcium absorption. It increased the calcium reabsorption from the kidney, but it will increase the phosphate excretion. So it will lower the phosphate level. So calcitonin from parafollicular cells or C cells of the thyroid gland, calcitonin secretion is regulated by the calcium, and high calcium will stimulate, and low calcium level will inhibit the calcium secretion. So this name is interesting, calcitonin. Calci means calcium, tonin means tonic. So increase the calcium, but it does not increase the calcium in the blood. It increases the calcium in the bone. And therefore, there is high level of plasma calcium level. It will stimulate calcitonin so that the calcium will be deposited in the bone. So the action of the calcitonin is to inhibit the osteoclast. So there is no more bone resorption. So that is the action of calcitonin. Other hormones that play in bone metabolism, for example, estrogen, that inhibit bone resorption. Corticosteroid, it reduces the gastrointestinal absorption and increase renal excretion. And therefore, if someone is on steroid, they will be losing loss of calcium and they will be losing the bone mass. Thyroid hormone increase the bone turnover, and by doing so, it favors the bone resorption. Therefore, those patients with hyperthyroidism, we need to keep an eye on their bone density. Growth hormone increase the gastrointestinal tract absorption of the calcium. I'm going to stop here.